Welcome to the deep dive. Today we're taking a look at something that affects a surprising number of people. Blood injection injury type phobia, often just called BII.
Exactly. And it's more than just feeling a bit squeamish around needles or seeing blood. We're talking about a genuine phobia.
Like a really intense, irrational fear.
Yeah, an excessive fear. It gets triggered by the sight of blood, sometimes an injury, or even just the thought of getting a shot. And, sometimes even things that just look like blood can set it off.
Wow. And what's really striking is how common it apparently is. I saw estimates around 3 to 4% of the general population.
That's right. Seems about right. And interestingly, it does seem to pop up a bit more often in younger people, and maybe those with less formal education.
Right. And it's worth remembering, too, isn't it, that a more general fear of needles, maybe one that doesn't hit all the BII criteria, that's even more common.
Absolutely. Loads of people dislike needles. But yeah, despite how many folks experience the full BII thing, it's kind of funny there isn't a really well-known catchy name for it.
Okay, so let's unpack what makes BII phobia so, well, different. It's not just feeling anxious, is it? There's a very specific physical reaction happening.
That's the key part. Spot on. When someone with BII phobia faces a trigger, they typically have this two-phase physiological response.
It's two phases.
Yeah. First, just like with other anxieties, their heart rate and blood pressure shoot up. But then, almost immediately after, the complete opposite happens.
The opposite.
The heart rate slows right down, that's bradycardia, and their blood pressure tanks, hypotension.
And that's where it gets really interesting, I suppose. That sudden drop in blood pressure, that can have a pretty dramatic effect, can't it?
Oh, absolutely. When your blood pressure falls that quickly, there's less blood getting to the brain, and that often leads straight to fainting. Vasovagal syncope, technically.
Right, the fainting response. It's the body basically overreacting to the trigger.
Pretty much, yeah. A very strong reaction.
And this isn't something that usually develops later in life, is it? Sounds like it tends to start quite early.
Yes. Typically, these reactions to blood, injury, or injections, they usually kick in before the age of 10. And, understandably, people with BII phobia will go to pretty great lengths to avoid situations that might set it off.
Which makes sense as a coping mechanism, but that avoidance itself can cause some pretty significant health issues down the road. We're not just talking about skipping horror movies here.
Not at all, no. This avoidance can have really serious consequences. People might miss crucial doctor's appointments, skip necessary blood tests, even avoid vital vaccinations.
And for people with certain conditions.
Exactly. Like for those with diabetes or multiple sclerosis who need regular self-injections, this phobia can seriously get in the way of their treatment. It's a big deal.
So it's clear the impact goes way beyond just physical health. It sounds like BII phobia can really restrict someone's life in quite a few ways.
It really does. It can influence big life choices, both personal and professional. For instance, someone might completely rule out a career in healthcare, obviously.
Right, to avoid the triggers?
Yeah. And the thought of pregnancy and childbirth, with all the blood draws and potential for injury involved, that can be a major source of anxiety too. And like you hinted, think about an emergency. If first aid is needed and there's blood, someone with BII might find it incredibly difficult, maybe impossible, to help.
So what causes this? Where does it come from? Is it like learned behavior or something else?
Well, our understanding is still, coming together, but it really looks like a mix of things. There's definitely growing evidence for a genetic component.
Meaning some people might just be more predisposed.
Exactly, potentially predisposed to developing it. But on the other hand, many people with BII phobia can often point to a specific traumatic event, something involving blood or an injury or a bad experience with an injection that they feel really triggered their intense fear.
That makes sense, sort of nature and nurture working together. But you mentioned earlier there's this interesting evolutionary idea about the fainting response itself.
Oh yeah, that's fascinating stuff. The hypothesis is that this fainting reaction might actually have been an adaptive survival mechanism way back in our evolutionary past.
A survival mechanism, how so?
Well, imagine being attacked or seriously injured, losing blood. Fainting could make you immobile, like plain dead, essentially. That might have deterred a predator or an attacker.
Okay, can see that.
And there's also the idea that the drop in blood pressure, maybe triggered by seeing blood, even your own, could have helped slow down further blood loss, sort of a primitive tourniquet effect.
Huh. That's a really intriguing perspective, like a biological safety feature that's just gone a bit haywire in this context.
Kind of, yeah. Misfiring, you could say.
So moving on from the why, what can actually be done about it? Are there good treatments out there?
Thankfully, yes. There are some well-established and pretty effective treatments. Applied tension, or AT, is often the first thing suggested.
Applied tension, what does that involve?
It involves the person deliberately tensing and then relaxing major muscle groups. Arms, legs, chest for short bursts, like 10-15 seconds, while they're being exposed to their phobic triggers.
Ah, so the idea is to counteract the blood pressure drop.
Exactly. By repeatedly tensing and releasing, they're basically learning to manually keep their blood pressure up, preventing that dip that leads to fainting.
And I assume the exposure is gradual.
Oh yeah, definitely gradual. Starting with maybe just talking about blood, then pictures, then maybe videos, slowly working up to more direct triggers.
Makes sense.
Well, alongside AT, there's applied relaxation, or AR, that focuses on teaching various relaxation techniques, deep breathing, progressive muscle relaxation to manage the anxiety itself when facing a trigger.
Okay.
And then there's exposure-only cognitive behavioral therapy, CBT. That's more focused just on the gradual, repeated exposure pictures, discussions, eventually maybe even being in the room with a needle or witnessing a blood draw. The goal being to extinguish the fear response over time through habituation.
So it sounds like, a combination of these strategies might often be the best bet.
Often, yes. Tailoring the approach to the individual is key.
Are there any quick fixes, things someone can do right in the moment if they feel a reaction starting?
Yeah, there are a few temporary tricks that can sometimes help manage the symptoms right then and there. Coughing, for instance, can give a quick, temporary boost to blood flow to the brain.
Really? Just coughing?
Yep. Also, drinking a decent amount of water before a potentially triggering situation, like going for a blood test, that can sometimes help by activating the sympathetic nervous system a bit and raising blood pressure.
Interesting.
And simple physical things, too, like tightly crossing your legs or clenching your fists really hard. Those can also temporarily bump up blood pressure and maybe help stave off fainting.
Good to know. Okay, so BII phobia has its own unique profiles, but it sounds like it shares some ground with other fear-based conditions. You mentioned dental phobia, hemophobia.
That's right. Dental phobia is often seen as related, sometimes even a subtype of BII, because the fear often revolves around invasive procedures involving, well, blood and injections.
Not always.
Not always, no. Some dental phobias are more about fears of choking or gagging, rather than the BII components. Hemophobia, though, that's specifically the fear of blood itself.
So BII is broader.
Right. BII includes fear of injury and injections too, not just blood. But both hemophobia and BII can trigger those similar physical reactions, including that potential fainting response we talked about.
You touched on the genetic side of things earlier. Can we dive a bit deeper there? Is the evidence for it running in families pretty strong?
It is, actually, quite compelling. BII phobia shows what we call significant familial aggregation. Basically, it clusters in families.
Meaning if you have it, chances are someone else in your close family does too.
Yes, studies have found really high percentages, some over 60% of people, with the phobia having a first-degree relative, like a parent or sibling, who also has it.
Wow, that's high.
It is. That pattern strongly suggests a genetic influence. One study even tried to estimate the heritability and came up with around 59%. But it's crucial to remember, it's not all genes. Environmental factors are still super important.
Like those traumatic experiences you mentioned.
Exactly. Or even just witnessing someone else have a really strong, fearful reaction to blood or needles, especially during childhood. It's that complex interplay again.
Nature and nurture. Got it. What about the brain itself? What's actually happening neurologically when someone with BII encounters a trigger?
Yeah, neuroimaging studies have shed some light on this. They found increased activity in certain brain areas, particularly the bilateral occipito-parietal cortex and the thalamus regions involved in processing visual information and sensory relay.
Okay.
But maybe more interestingly, they've also seen decreased activity in the medial prefrontal cortex, the MPFC.
And the MPFC does what?
You can sort of think of the MPFC as part of the brain's control center for emotions. It helps regulate fear responses. So reduced activity there might mean that the brake on the fear reaction isn't working as effectively in people with BII when they face their triggers.
So the fear response kind of runs unchecked.
Potentially, yes.
Well,
less regulated, certainly.
This phobia, it sounds like it can really ripple outwards, causing issues beyond just the immediate fear reaction. What are some of those wider implications?
Oh, the impact can be pretty substantial. We often see it co-occurring with other conditions.
Like what?
Other specific phobias are common, but also anxiety disorders like panic disorder and social anxiety, depression, OCD, Even substance use issues, particularly marijuana abuse, seem more frequent.
And specific health links?
Yes, particularly in individuals who have diabetes alongside BII phobia, they tend to have higher rates of peripheral vascular disease and cardiovascular disease, likely linked, at least in part, to avoiding necessary medical care and monitoring because of the phobia.
That makes sense. And it's not just about the individual experiencing the phobia, right? There are bigger public health considerations too.
Absolutely. When people avoid vaccinations due to BII phobia, it chips away at community immunity levels, increasing the risk of outbreaks of preventable diseases. That's a serious concern.
And blood donation.
Right. The fear prevents potentially many people from donating blood, which impacts the blood supply available for transfusions in emergencies. And as we touched on before, the limitations on personal and professional lives can be profound, even influencing major life decisions, like whether to have children, because of fears around pregnancy and childbirth.
So just to circle back, while anxiety is definitely part of many phobias, it's really that specific two-phase physical response in BII, the one leading to the potential fainting that sets it apart.
Precisely. The initial anxiety is there, for sure, but the hallmark, the key differentiator of BII phobia, is that biphasic cardiovascular reaction. The up, then the sharp down in heart rate and blood pressure, which can result in fainting.
Although not everyone faints.
Correct. While it's common, maybe up to 80% of people with BII report fainting, at some point it's not universal.
Yeah.
You can have BII phobia without actually fainting, but still experience that profound drop in blood pressure and the associated symptoms.
And besides the fainting itself, what other really intense physical things might someone experience during an exposure?
Well, people might report extreme chest discomfort, tunnel vision is quite common, looking very pale, feeling clammy or shocky, dizziness or vertigo, profuse sweating, intense nausea.
Sounds awful.
It is deeply unpleasant, and in very, very rare and extreme cases, there have even been reports linking severe phobic reactions to cardiac arrest and death, along with, obviously, a massive surge in stress hormones like cortisol.
That's terrifying.
It is, but it's important to stress those extreme outcomes are incredibly rare. The encouraging thing is that generally, once the trigger is removed, these symptoms tend to resolve relatively quickly.
Okay. So to kind of wrap up this deep dive then, we've covered quite a bit about blood injection injury type phobia, its surprisingly high prevalence.
That unique two-phase physical response, the bradycardia and hypotension, leading to potential fainting.
Right, the significant impact it can have on people's health, their choices, their whole lives, really.
And the potential causes, that mix of genetic predisposition and environmental factors, like trauma.
And importantly, the fact that there are established effective treatments available, like applied tension and exposure therapy.
Definitely. That's a really comprehensive summary. It highlights that PII phobia is, a legitimate and significant condition with far-reaching effects. It's much more than just a simple dislike or squeamishness.
Absolutely. And that leads us nicely into our final thought for you, the listener. Considering just how common BII phobia is, and the wide range of ways it can impact individuals and even public health, how might a greater collective understanding and maybe less stigma around this condition lead to better support and outcomes? Better help for those who experience it, both on a personal level and maybe within the community as a whole. It's definitely something worth thinking about. Thanks for diving deep into BII phobia with us today.